anonymous, accessible, and affordable mental and emotional support to Kenyans. Next on the panel, we have Lucy Wairimu Mukuria. She's a mom, a career psychologist, and she's a pioneer military psychologist of the Kenya Ministry of State of Defense. She resigned her commission at the rank of Major to advocate for Kenyan veterans and their families. Her personal and professional motto is purpose by building on the human spirit. She does this under the banner of a nonprofit platform called True North Society, whose mission is to lead the way through action to pay our veterans back for their service by ensuring war wounds do not limit their life experiences and tragically their life expectancy. Then we have Dr. Daphne Wambui. Dr. Daphne is a mental health therapist, advocate, and consultant with a strong social justice and multicultural background, as well as unwavering passion for helping individuals and communities overcome adversity and thrive. She has worked in various settings, including NGOs, higher education, and private practice. Daphne has been in the field for more than 15 years, having attained master's and PhD degrees in the field. She currently serves as the Mentor 360 lead counselor. Last but not least, we have Mheshimiwa Stella Waruinge. She's a health psychologist. Stella, if you could just wave to the audience, and the mental health coordinator under the NMS. So she's representing the county government of Nairobi. Yeah, so it's amazing. We have a panel of ladies. I think that speaks to how ladies are very passionate about mental health and the leaders in driving this agenda in the country. So you're all welcome, panelists. We will dive in straight to the conversation today. I'll start by asking, and this goes to all panelists, how has the experience been for you in this period? In the areas you serve, and how did you handle it for the last 3-4 months as pertaining your work in mental health? I'll start with you, Ankiza.
Thank you, Bright, and hello, everyone. I'm very excited to be part of this much needed conversation about the future or the next steps for mental health in Kenya. COVID has changed our realities as we know it. I think many of us have seen a lot of struggle and strife in the areas of family, work, and finances. So Inuka serving everyday Kenyans and everyday people has really seen an increase when it comes to the amount of users or clients who are coming in with a lot more acute, I would say, mental health issues and struggles. So we have found that normally pre-COVID, we primarily deal with clients who are coming in with anxiety and depression symptoms, but usually not as acute as it is. We're seeing a lot more suicidal ideation cases, and therefore we find that even our coaches are needing a lot more support. So it has been a very strenuous time and a busy time, but the good news is that people are reaching out and asking for help more.
Thank you, Ankiza. And just to mention, we have a sign language interpreter. So if you're joining or you have a deaf person, her name is Kaziri, sign language. You can just pin her on your profile for you to follow the conversation. Wangari, do you want to say something? How has it been for you?
Thank you very much, Bright, and this wonderful forum. I work primarily with people with disabilities, and the disparities brought by COVID-19 have accentuated the need for mental health. According to me, there have been 2 pandemics, really. The mental health pandemic and the COVID-19 pandemic. The mental health one was there much longer prior, but I must say there have been so many opportunities such as this one to collaborate. And as we discuss the way forward, I guess we now really need to pin down some timelines and some actions of the various stakeholders. For instance, in the field of disability where I work, there are quite a number of stakeholders who are disability service providers. They are on this call. I'd like to recognize the presence of Mr. Francis Makwata, the Nairobi County officer for National Council of People with Disabilities. And in Nairobi County, being uniquely the capital city, there are large numbers of people with disabilities who come in just like everybody else to look for a living. And I must say, COVID-19, mental health and disability have seen a convergence in efforts of collaboration. I must say, going forward, there's a lot of optimism from my side on how we can all come together as multidisciplinary stakeholders. Thank you.
How about you, Daphne? I know you work a lot with youth at Mental 360. How has the journey been? What have you done in this period?
What we've seen during this time of the pandemic is we increased anxiety in general, and we're seeing more and more clients who are in crisis, more individuals who are experiencing a crisis. You know, the stresses of the pandemic have really added on to the burden of maybe even already pre-existing anxieties and other mental health conditions. So we are tending to see more people in crisis. And also, coupled with that, there's been a challenge with accessibility. You know, we're used to doing one-on-one counseling, in-person counseling. And so because of the physical distancing restrictions, you know, there's been some challenges with access and also, you know, with finances. So what we've actually done at Mental 360 is to make services more accessible is to we transition to virtual counseling. We are doing telehealth. We are offering online or phone counseling or WhatsApp counseling. So whatever is convenient for the client, we really try to make our services accessible, and also having clients pay what they can afford. We determine that upon assessment of the client's situation. So we work really hard to make our services more and more accessible.
Yeah, thank you, Daphne. And I'll move to you, Stella. I know you're from the NMS. From the administration angle, what has been your experience? What have you done in this period to limit the impact of mental health on people in COVID?
Thank you, Bright. And yes, I think as Nairobi being a capital city and where it was the epicenter of the pandemic, we were the first to have the cases, and up to now we have the highest caseload. I would say for us, despite everything that is happening to COVID, I think for us it has been a learning experience. It has made us realize, as everyone is saying, the need of mental health for everyone, more so to our population. What have we done is that when the epidemic started, there was a lot of anxiety and even our mental, despite us having a mental health unit, we had not put the systems strongly enough. But the pandemic has given us a chance to pull all the mental health practitioners together, to have more added together. And as Delphine talked about, change in the way we deliver psychotherapy in terms of telecounseling and telepsychiatry. It may be a challenge.
I think we lost Stella. Are you still there, Stella?
Yes, I am. You can't hear me.
Okay, go on.
You can hear me?
Yes.
So I think what we have done is that we have improved our mental health services and structures. We have increased our service delivery, where we have added additional counselors and psychologists to the team. We have up to now, we have gotten a need for the children, where we have established a child-friendly therapy center in one of our facilities in Gaira Health Center, where we are focusing more on trauma-focused CBT in terms of children, because we know in all these, one of the most vulnerable population is the children. So we are focusing to children, and we're extending this support to up to 24 years, because we know at the end of it, as adults, we may cope, but we are looking for a generation that is going to be there in the next few years. What kind of generation are we going to talk about? So we want also, even as we move from COVID, to be able to have a generation that still is mentally resilient enough not to always talk about the effect of COVID, but can they be resilient to still be productive in the society? So yes, it has been a challenge, but I would really want to appreciate the growth and the support from the NMS management that has been on board to support mental health delivery services. But there's still a gap that this forum would bring resources together, partners together, so that you can be able to collaborate. Thank you.
Thank you, Stella. And as I move to Mukuria, I'd love to mention that in this period, and especially on World Mental Health Day, which was on 10th, there were statements made, from example, from a lady called Shantarao Bariga, who's a leader in the mental health space. And what we've seen in Africa, in her statement, she said that African governments spend less than 1% on mental health. That is about 25 cents per person per year. And of that 1%, and that 1% actually goes mostly to salaries and procurement of drugs, basically to psychiatry. So even in developed nations, you have a rate of $80 per person per year. And that means, again, 80% of these resources are going towards psychiatry. So we're going to speak on, Mukuria, what in your opinion is assessment of where we are as at now? What are the statements you've had from WHO, from the country leadership, and what is your assessment of where we are, and what do you think about that?
Okay, first I think let me begin by sharing about the impact of the pandemic on our activities. I think it's only fair because we have a very unique model that I feel is really ahead of its time, where we combine mental wellness with entrepreneurship for the purposes of sustainability. And of course, this is because of understanding the low and poor investment that is in mental health and the need to create a very unique model that meets the needs of our clientele. So when the pandemic struck, our production for rabbit jerky had to come to a standstill because, number one, what makes the production process happens in 3 counties. So when there was the containment measures, we just died. Then, of course, we use a production facility that belongs to the government. So when people didn't quite understand what was happening and everything was shut down, that was also shut down. So that, of course, got laid off. And even when the containment was lifted and there started being movement, I still did not want to reactivate things because what the chances of infection for the people who do this work, they don't have medical insurance, right? Because again, we are also talking about universal health care and that being provided to people. So you have to be able to see how to relate, joblessness and despair and depression with, lack of universal health care, but criminalization also of the mental illness. For me specifically, as a military veteran, we have the Defense Forces Medical Insurance Scheme that categorically says it will not treat people suffering from mental illness. So you can see like how that put everything down. But on the other hand, we have the petition that has now actually evolved into a draft bill that is at the Senate Committee for Foreign Affairs and Security. So that process has been going on. And why it's important to mention this process is because when it comes to effect as a law, the military veterans law will actually bring a lot of healing and lift a lot of military veterans and our families from a lot of, psychosocial, legal, economic, spiritual burden that of course affects our mental and physical health. So it's been sort of, lose but gain. So that has been the True North experience. Now let me come to what we are discussing today in terms of reviewing what was talked about on the 10th from a global perspective and also from our local perspective. Of course, globally, we know that the WHO is the one that is able to accelerate this process. They are a bigger body, they have more money, but with the current situation in the world, they are also experiencing poor funding. So that should tell us as a country that even if we are looking at WHO to be able to come and support us financially, well, they are having a problem themselves. So the idea of a self-sustaining model becomes even more critical. Of course, they have spoken a lot about the issue of greater investment and greater access. And locally, we have seen that issue discussed a lot. You know, this is something you can Google and you'll find. Yes, it is a fact. Kenya spends 0.01% on mental health care at a national level. Let me tell you how disturbing that is. It's so disturbing because we have a universal healthcare system that is devoid of the mental health component. So already you can see there's an exclusion as opposed to mainstreaming for mental health services. Every year we hear what will be done. This year we have been told that there will be a regional hospital, or don't know, national, biggest, best, you know, hyperbole. We are told there'll be 4 regional hospitals. Everything you're told is in the future. Every year, everything we are told is in the future. But on the ground, guess what? People are still taking their own lives. People are still driving drunk. Domestic violence is still going up. And those many other psychological disturbances and psychiatric illnesses that actually are costing people their jobs, which therefore means that we cannot be able to have these people support themselves or even support the economy of the country. Most critically, I think, to be able to understand, which for me just blows my mind, is that when it comes to issues of our ability to borrow loans, suddenly we are a middle income country, you know, and it is proven by, you know, our inability to have like multilateral trade exchanges with, you know, countries because we are a middle income country. But when it comes to being able to support and make room for issues like mental health, you know, we are a low income country. We shall require funding from the World Bank, for example. And the World Bank has come through. It has been able to fund 134 counselors and psychologists in the last advertisement that was COVID related. But again, it is only for 6 months. What happens after the 6 months? We don't know. Maybe we have not been told. Let me not assume that there's no plan. But 134 funded by the World Bank, and this is going to be for the next 6 months. So where did these 134 people go? They went all over the county, but of course, Nairobi got most of them. So let us look at also Nairobi getting most of them. Where did they go? They went to Mathare Hospital. And I'm very happy about that because having worked at Mathare very early in my career, those people have so little to do the so much that they do. So right now, you have the highest number of counselors and psychologists that has ever been in this country in Mathare, and that's great. So let us look at what they're doing. Being able to take care of the patients who are already there under psychiatric care, which means they're under a treatment model that is pharmacological, right? They are also there taking care of the staff that is there, which is fantastic. Because I think when it comes to our profession, it is the only profession where you take care of people, but you have to have somebody else take care of you. And that person is also taken care of by somebody else. That's the sustainability model, right? So let's talk about access. There is a Thursday clinic that now is happening, and it is, you know, people are paying, which is great. And for the first time, it is more for therapy than it is for a psychiatric evaluation, which is fantastic because people need to understand that when we talk about psychotherapy, we're not talking about the 5 minutes where you ask, how are you feeling? How did you sleep? Are you having nightmares? No, you actually process thoughts. So the idea of even payment is important. Having those people go to job group J, I mean, it's a good beginning. It's a good beginning, but if they get sick, they don't have medical insurance. That is also something we have to. Okay, thank you.
Sure, sure. Thank you. Thank you. Those are very, very, very nice points you've made. And I love to piggyback on that. Now we've ascertained for sure that there is very little spent in community services from government. Um, and there is need to spend more on community services. And I know people like Inuka have come up with innovative ways to, there's a mention of the friendship bench and technology. Kiza, would you love to expound on that and what your model is in terms of the community element of approach towards curing or helping in this problem?
Yes, I mean, I love what Mukuria said. As much as government is doing the best they can, they also have their limitations. So I think it is definitely community-led organizations that are sometimes best able to deal with the problem. So maybe a bit of backstory about Inuka Africa. So our co-founder is Professor Chibanda, as you mentioned, Bright, who is well known for founding the Friendship Bench, which is one of the world's lowest cost interventions. And initially, he began by simply training grandmothers in problem solving therapy to treat anxiety and depression like symptoms. And what Inuka Africa has done is we have digitized this. And what we do is we train local community heroes to become coaches. We then connect them via confidential chat with people who are dealing with anxiety or depression like symptoms. So again, this is very much about putting together two pieces of the puzzle when it comes to dealing with mild to moderate mental health issues. Of course, we are not a medical service, and there are, like you rightly mentioned, with Chiroma Lane, etc., or Madare, hospitals that specialize in that. But not every case, and I would argue the majority of cases are not acute. And if we catch them early, we are able then to prevent also the long-term cost of caring for people who are struggling. And I think in Kenya alone, I think we've heard this statistic that 1 in 4 Kenyans are suffering from anxiety and depression, and 80% don't receive any care for 3 main reasons. One is the lack of healthcare professionals. The WHO has said there is only 1 mental health worker per 100,000 person. The high costs of care, as we know, even procurement of drugs, most of that 1% actually goes to salaries and drug procurement, and then the high levels of stigma. So in short, we know that 11.5 million Kenyans are being deprived of a healthy and productive life. And that should not be the case. So as much as we advocate, of course, for medical support and psychologists and psychiatrists, and we also work closely with them, not everybody falls into that category. It is not a one-size-fits-all. And oftentimes, by simply doing a well-being scan or a scan we have, you're able to even assess for yourself, so empower yourself to know, am I at risk of chronic stress, of anxiety or depression before it happens to me? And how can I more easily connect with a coach? So we are fully digital, and our platform has an inbuilt supervision system that ensures consistent quality of coaches, and all our coaches are supervised by a psychologist. So by coming on the app, which is app.inuka.io, what is at least good is that we can reach you on your couch or wherever you are. It is chat-based, so it's very anonymous and easy for you to reach out. And I think sometimes access can be as simple as mobility. Am I able to even afford to get on a bus and go to a hospital? Or am I able to afford the fees of a psychologist? And most Kenyans are struggling to afford even living as opposed to going out and getting care. So we hope that by joining forces with more community-led organizations, we will have a holistic view of mental health. Sometimes financial worries or relationship troubles can lead into much more severe cases. And simply having the right support and learning the right coping mechanisms can help you mitigate a lot of these acute issues. So government often perhaps is limited in how they can act or how fast they can act. But what's great about community-led approaches is that we are on the ground every day. we are closer to the end user, and therefore we are better able to serve them.
Thank you. Thank you, Akiza. And members, guys who are attending, feel free to shoot any questions you have on the chat platform. We'll be having at the end of this session a period for Q&A with the panelists. So if you have any specific question to any of our panelists, please note it down, put it in the chat platform. We'll read it out at the end of the session. I'll come to you, Daphne. Akiza has mentioned community-led organizations. And we know that not everyone is able to access technology or able to even use an app. At Mental 360, what strategies are you having in place to adopt the same model of community engagement so that these services can be, people are empowered to support each other?
I didn't get your question.
Ankiza has mentioned about community-led organizations, and we know that not, everyone can't access a mobile phone or technology. So what are you doing at Mental 360 to ensure that this knowledge about support is decentralized to the community level?
Yes. That's a good question. I think one of the things that we are doing at Mentor 360 is doing a lot of awareness campaigns in the communities, all over the community. And for example, we've had a campaign where we're distributing masks and talking about mental health and how to access our services. So really being on the ground in various communities, including some of the traditionally marginalized communities, including such as informal settlements. We've had our presence there, and that is in addition to the social media campaigns that we are doing. So we are hoping that people will know more about mental health, what mental health is, and how to get help if they're experiencing challenges. Maybe you can add to that, Bright, if I missed something.
Yeah, thank you. I think that's well said. I'll come to you, Stella, and I know Mukuria earlier mentioned about the budgeting process, how much is being given to mental health. She quoted 0.01%. And again, most of these, as was mentioned earlier, is going towards psychiatry and procurement of drugs and salaries. As NMS, now we are turning the heat on you. What are you doing to alleviate this problem in terms of resources? We need solid money going towards mental health. What are you doing as NMS for this?
I must say the problem cuts across, and it's true. Globally, we have a problem with allocation for mental health. But speaking as NMS, I would say all is not dull because I've seen an improvement since the unit was created. We started off with 3 million. That sounds like a drop. We went to 5 million. And for this current financial year, we have been allocated 7 million. That is by the NMS for the 2020-2021 financial year. Well, this may be very little. I think it is a step forward to see us implement the most urgent and critical aspect of intervention. For example, to be able to roll out MHGAP, because this one is going to see us going into communities and having a higher suspicion index for mental health. And now in the part of post-COVID, because we know post-COVID we have already started seeing high levels of suicide and depression. However, that is not enough. We are in the process, and you find that
Hello, are you there?
Can you hear me?
Yes.
We have made step in terms of employment. We have never had a mental health psychologist being employed.
Sorry, I think we keep losing you. Are you still there, Stella?
I don't know. Can you hear me?
Yeah, go on.
Yeah, I don't know what's happening today. The internet just messes me up. So we are making strides. We have challenges with psychotropics where you find that we don't have some places, they're not there, and it's not whatever is there is not enough or is not what is the preferred. But it's a journey. We are working it. We have a lot of support with the new management, and I believe by the time we in the next financial year we are going to see more allocation, or even when we go to supplementary budget, we're going to find more allocation happening towards mental health. But yes, it's a challenge, but we are on.
Yeah, I'll turn the heat still on you, Stella. When you say we will see more allocation, do you have a figure in mind? Do you have a percentage in mind? And where is that allocation going to? Is it going to still, is it going to employing counselors, or is it going towards community-driven work? Do you have any ideas on this?
Initially, we had asked because for us allocation it goes with what was
Hello?
hello. We don't have a defined percentage of allocation. What, like, for example, in the national government, every county is supposed to allocate about 30%, 31% of their total budget to health. We are still yet to go to define what percentage of
Sorry?
we are not yet, we don't have a defined percentage that that is there. And that one is something that should start from national. Because if national is saying that they get maybe
Sorry, we keep losing you, Stella. Are you still there, or should I move on to the next question? Okay, so if you have any questions, please feel free to keep on sending them via chat. We'll be going towards the Q&A with the panelists. If you want it directly answered by a specific person, please feel free to mention their names. We have Lucy Wairimu once again from True North. We have Daphne Kagume from Mental 360. We have Joyce Wangari, who is a disability psychologist. We have Ankiza Gakunu from Inuka, Africa, and we have Stella Waringe from NMS. NMS means Nairobi Metropolitan Services. As we go on, Inuka and Mental 360 and also True North are giving giveaways. Inuka is giving away free sessions on WhatsApp. You can reach out by clicking a link in the chat platform. Mentor 360 is offering free fast sessions for people who are going to reach out today. So if you've never gone for therapy and affording therapy is a problem, today is the day for you. Reach out, access free services. And at Mentor 360, also their services are on a scalable approach where you pay what you can afford. So feel free to reach out. True North are also doing any personal questions answered via WhatsApp. They have a WhatsApp number 0748540822 on the chat platform. I'll go to you, Wangari, Joyce. Now you are in a very interesting, uh, sector of disability psychology. So has there been any support for you from the government, or how are you able to do your work? Under what platform are you working? I'd love to hear from you, and I'm sure people love to know how that works with disability psychology.
Yeah, thank you so much, Bright. And I would like to also acknowledge Brenda Kiema from University's Disability Inclusion Network. So I am in private practice, and as a consultant, I work with several consortiums, one being the university's Disability Inclusion Network, where we have organized almost all the universities in Kenya that are accredited by the Commission for University Education and are doing a grassroots approach of mobilizing students in the universities for disability inclusion clubs. These clubs are awareness platforms and advocacy platforms. In addition, I work with 150 families around Nairobi and its environs in psychosocial support and mental health, where just like our fellow panelists have said, we combine socioeconomic empowerment with socio-emotional empowerment. I would say on the socioeconomic empowerment pillar, a lot of the families I work with have been very proactive. They start CBOs or welfare groups. And with that, they, as Mokuria so rightly said, one of the greatest factors affecting mental health, actually the greatest factor is socioeconomic. And so they begin table banking and they begin to talk about what's really going on behind closed doors. As you know, people with disabilities face significant challenges, especially now during coronavirus and even in mental health. In addition, the socioeconomic pillar has first and foremost attitudinal change. We know that stigma-informed interventions is very key, and the WHO has recently rolled out a free course called Equality Rights. I was trained on that course, and it's a beautiful course. I'd like each one of us to do that, whereby every human being does have rights. And it's actually drawn from the United Nations Convention for the Rights of People with Disabilities. So under the socioeconomic pillar, we really tackle the issues about stigma, which is about shame and regarding disability as a curse rather than, you know, a blessing. And a lot of times families get stuck there. So where I really come in is the interface between, say, parents, teachers, and other caregivers with children with disabilities. And you find that a teacher or a parent can make a whole plan for a child, but the other party, either the teacher or the parent, usually mostly, you know, the parent will be stuck with, why is my child like this? So aside from socioeconomic and socio-emotional empowerment, I must say the other work that I've really been doing is combining public health, basic education on COVID-19 interventions with mental health awareness. As you know, people with disabilities in Nairobi County and in other counties and other nations, even in Africa, are left behind. There's a lot of information access barriers. The population that I specialize in, the deaf, are really left behind. There's not adequate information in Kenya Sign Language. I'm glad today we have a sign language interpreter, otherwise this forum would be inaccessible. And people with pre-existing health conditions, generally, now when we speak about mental health, therefore qualified to also have psychosocial disability. And we know that disability, according to the WHO, is a very big cause of the DALIs. There's a cost to quality of life when you have a condition. Even a condition like depression can actually create a situation of disability if it's really, really severe. So people with disabilities are currently really suffering just basic hygiene measures. A lot of the sinks for hand washing are inaccessible to people on who use wheelchairs. Physical distancing for people who need additional support, somebody really close to them. You know, there's just a lot of information barriers, as I said earlier. And then the biggest barrier, I would say, is the barrier to accessing healthcare in general. So there has been some serious service disruption. For instance, if you have a person with cerebral palsy and they need to attend their weekly physiotherapy sessions, you find that these people are really struggling just to get by, to create the resources they need to get to the centers that are still open. And these centers, most of which have shut down because of the containment measures for COVID-19. And therefore, I also do training for disability service providers and really creating that human rights approach so that we say every human being is entitled to basic healthcare and dignity, and developing the standards we need for service continuity, especially with all the disruptions, as I've mentioned earlier. Reducing potential exposure to COVID-19 is a good idea. I think going forward, what this webinar is saying is we can create very formidable, sustainable structures. And these are basic, simple things. At the community level, if you're a family, a friend, a neighbor, then you know that you can reach out and give extra support to somebody with a disability that you know that might require you know, some support for flexible work arrangements. A lot of us are now working from home, you know, just continuing the basic protection measures, we all know what those are, but increasing access for vulnerable populations is really key. And I do not think that was adequately addressed this whole last weekend, as we said, Happy World Mental Health Day. I'm not sure that people with disabilities will chime in with us and say Happy World Mental Health Day as well. Thank you.
Yeah, thank you. Now we'll move on to the Q&A before and I'll start with a question from Mr. Kimathi K. He says, this is all very interesting to me. What have you noticed is the most successful way to address stigma amongst men with regards to mental health? Basically, what's the best way to get more men in therapy and counseling? Ankiza, do you want to tackle that?
Yes, well said, Kimathi, for that. You know, I said once we also heal men, we heal the community. We found that confidentiality and ease of access was really key for us as Inuka in developing our services on WhatsApp and as an application. So 70% of our users are female, but 30% are men. And the men always give us the feedback that confidentiality, anonymous, when they log into our service, they're given an alias name. So nobody knows who they are. And number two also is it's chat-based. Men sometimes feel quite uncomfortable speaking face-to-face about issues. And furthermore, the technique we use in the Inuka method, it's not so much maybe about talking about feelings, but it's a very practical approach. So you are able to sit down with a coach who walks you through a sort of action plan or well-being plan and invites you to tackle your solutions one by one. So we have diverse forms of therapy, of course, with all these organizations and wonderful psychologists, psychiatrists here on the platform with us today. But in specifically for the Inuka method, it's really something that you do not have to have, you know, extra skills in discussing feelings or not. And so the types of interventions or coaching that is available really matters for men. And again, the anonymity factor. So who does not want to be on their mobile phone anonymously and still be getting support, right? Without having to go see someone face to face. So these are ways that we've found are really effective for men.
Yeah, Daphne, how about you? What has been your experience regards to men and the work you do with Mental 360?
I think I agree with Ankiza that confidentiality is really important, and honoring, people's wishes with regard to how they want to interact with the therapist or with the helper. I think that's important. I think the other key factor is actually addressing issues, the stereotypes about masculinity and what it means to be a man and to be masculine, and some of the issues around some of the stigma around seeking help as a sign of weakness. I have found that just general awareness and education about and countering those stereotypes about about what it means to be male or what it means to be masculine has also been really helpful in giving men permission to seek help for the challenges that they face.
Yeah, and Mukuri, I know you work especially with the military, and actually, according to me, over 80% of them are men. How has been your experience been on that front? And as a lady who's driving these, I don't know of any man who's talking about mental health with a military background. So how has it been for you?
Well, I think one thing that my experience taught me is that it is us who separate, mental illness or mental health according to gender. But the devastating effects of mental illness or psychological disturbance is well balanced, regardless of gender. And I guess it's important to realize that that is part of the narrative that perpetuates stigma, and it is man-made. So at the end of the day, even as we say that men are, stronger What does that mean exactly? Are they superhuman, multi-human? Of course, that's not the case. When we say that women are weaker, is it because they cry? Well, crying is very important. So I think we have to be able to understand that it is our own creation, but at the end of the day, the impact of mental illness and psychological disturbance does not know gender. I think that's a very important point to note. I also just want to do a small correction. I had said that 134 psychologists were under the World Bank, but it's actually the Universal Healthcare Program. Those ones under the World Bank are actually 20. Yeah.
Okay. Thank you. Thank you, Mukuria. There's a question here from Georgina, and she's asking, what are some of the approaches or activities that we can use to ensure there is synergy among the existing mental health organizations and initiatives to ensure we have the largest possible population reached from a common front? Anyone who can take that?
I'm sorry, say the question again.
What are some of the approaches or activities we can use to ensure there is synergy amongst the existing mental health organizations, stroke initiatives, to ensure that we can reach the largest possible population from a common front?
I'll answer that. And I think that's such an important question, because I think those of us who are doing this work need to understand that we can only do so much. Now, let me give you my lessons from the trenches, and that's why I decided to take the legal route. There's only so much you can do as a non-governmental entity. And it's at a, even if you connect with the other people. And why is this? Because we are seeking a public service solution privately. Now, I would think that the one thing that COVID has taught us is that this idea of seeking private solutions for public services is our undoing. You've seen what has happened to schools, to health, to all public services that you can be able to think of. So I would say to organizations moving forward, we should begin to think about how we can be able to do our work, yes, but hold the government accountable. All these things we are being told about a regional hospital, blah, blah, whatever. But the truth of the matter is that there are those Kenyans who believe that mental health is a human right. And that's why we have, for example, the mental health policy. This was published in 2015. This was not mentioned. Who is supposed to actually operationalize it? Who are we supposed to hold accountable for operationalizing it, right? And it is 2015, 2030. That's a mental health policy in this country that was done. We have the Mental Health Amendment Bill, 2018. So since 2018, the process has been really slow. The last time I caught up with it, it was actually in the House. And it was with the Committee for Health. What has happened since? That was not told. We have the first mental health conference. We came up with 10-point memoranda. That was not touched on, and it was very critical things. We have, of course, the Military Veterans Bill 2020, that is still moving. There's the task force report 2020. Where is that? We are just told it was given to the cabinet, whatever. We have the newly assented mental health laws amendment 2019 that spoke about making of the mental health board. Now, let me tell you something already about that mental health board. It does not give room for a psychologist, right? So already we are in trouble. I also want to tell you about the situation that we are in. We have 284 level 4 hospitals. Only 29 out of the 204 can actually provide mental health services. Think about that. As a private institution, how do you even fight with that? We have 47 counties. Only 26 of those offer psychiatric care. Psychiatric, which means pharmacological, which means treatment. So even, no matter what you do, as long as suicide is still a misdemeanor in this country, which means it's been criminalized, there's only so far you can be able to go. So we have to be able to work together to hold accountable and make follow-ups of these documents that have already been done, but also the people in these offices who are supposed to make this happen, from the cabinet secretary to the DG to the, CAS, all these people, where are we with these processes? The people who are in the county governments, you saw Kibwana the other day coming on Twitter saying to this young man who was saying he was at the end of his tether, he said to him, come to Kibwezi. Right now in Madare Hospital, there's only a clinic day on Thursday, but there are no admissions happening. So all these people who need admission, where are they going? That was not talked about, right? So we cannot continue to seek private solutions to public services. We have to be able to actually be able to speak up and say, no, 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 no. You need to invest more. You need to create better access. And this will be very critical moving forward. So we can continue doing what we're doing, yes, but we have to understand we will just be mark timing. Thank you.
Thank you, Mukuria. I agree with you, and I sense your frustration, especially because I was following up on the mental health amendment bill to realize that it got stuck at the budget committee. So it was at the health committee of parliament. Now it's back to the health committee, and there's a lot of politics going on with a very straightforward issue. So it's very unfortunate, and I agree that coming together with one voice and speaking with one voice is going to push these people to make these necessary changes. And maybe to also add on that, and I'll involve the rest of us. We are working also with Senator Kasanga in a program to push the mental health amendment bill, and also the decriminalization of suicide. It was very sad when I saw in our support group last week, I think, that someone in Vihiga had been arrested because of attempted suicide, and they were actually grabbed from hospital to be taken to jail. So that's quite unfortunate. I'll move on with the questions. And we have a comment from Stella from NMS. She had a problem with her audio. She says that we have mental health services at different health facilities. There is Gaira Health Center next to TUK. Here we offer child-friendly therapy. At Ngara HC, we have psychiatric and psychotherapy services. I don't know what HC stands for, but at Ngara, they have the county at the NMS, Nairobi Metropolitan Services, has psychiatric and psychotherapy services. At Kangemi, Kariobangi HC, we have a psychiatric clinic. And so I think also with this, we need the county government to be also out there in terms of telling people that these services are available. Because it's one thing to build something, but if you're not making noise about it, no one knows it is existing. So I think we also need to improve and work more on that. There's a question from Lillian. How are the mental health organizations working towards partnering with insurance companies? Anyone wants to take that?
Yeah, I'll take that. Thank you for that. In fact, the facts on stress and burnout at work are very distressing. According to World Vision statistics, 36% of work-related illnesses are due to stress or burnout. And I think insurances are now catching up to the fact that 25% of outpatients and 40% of inpatient visits to a clinic have underlying mental health challenges. And the effects of this is 1 trillion per year is lost due to productivity. And there was an article last year that we were involved in about Kenyan companies are losing billions because of this. So we are actually running pilots at the moment with 2 insurance firms who have a combined coverage of about 1.2 million employees. It has been maybe a bit slow, considering the fact that our, if you like, innovation is a bit unique, but it's very needed because we find insurance also realize that just simply having a medical cover and people going to see a doctor, perhaps for stress-related issues that can be solved very effectively through coaching or other therapy methods, it does not make sense. So I think also companies need to demand more from their insurers. They need to put employee health and productivity at the heart of their whole approach, people-centered or people-focused approaches. So we're working very hard, sort of lobbying companies, the big companies and corporates, to let them know that, you know, put your employees first. A happy employee is a productive employee, which is a win-win situation for both, yeah? And So we are really working on that. We hope that we will soon have services like ours available under medical cover for employees.
Yeah, thank you, Nkiza. We have Kimati again, who is asking about couples counseling. Do we have organizations that offer couples counseling? Yes, I think it's been answered in the chat. Mentor 360 does offer, and they have a helpline where you can reach out and get scheduled. It is 0770 360 360, just like that. So that's easy to remember. 0770 360 360. There's another comment here, or question rather, from someone who's directing it to Stella. Stella, you're being asked for phone contact for your centers or email. So if you have any phone contact for your centers, please share via chat. We have a question from Seska, who's asking, hello, what institutions can I visit for mental health, i.e. psychotherapy? How do I pay for my sessions, cash or medical cards? I think we just spoke on that, Seska. We have institutions like Mental 360. You can reach out to Wangari Hospital. You can go to the centers that Stella just mentioned up there, and she's going to give contacts shortly. We have Susan Omolo. She asks, my question is, Inuka has mental assessment questions whereby an individual can gauge where they are mentally. Agencies like Mental 360, NMS, and True North, what sort of criteria do they use to gauge an individual's mental health before coming to the conclusion that an individual is in a critical mental state? Daphne and Lucy, do you want to take that?
It was a long question, Bright. I needed to repeat at least the last part of it.
So the question is, Inuka has a mental health assessment questions, the methodology to gauge an individual's mental health. What do agencies like Mental 360, True North, what criteria do you use to gauge an individual's mental health state before concluding that they are in a critical mental state?
Okay, thank you. So at Mentor 360, we have a helpline, which is usually our first line of contact with individuals who want to access our services. So they'll call our helpline and talk to a staff member, and the staff member will do an assessment. And based on that assessment, then they'll make a decision as to what level of care to, or which therapist to assign that client to. And also part of our intake process is we have online forms that clients can fill once they've decided to go ahead with counseling. So we do have that combination of our intake staff on the helpline plus the online form.
I think I want to build on that, because what I am hearing is, I think what is out there, a huge misconception about psychology and mental health care. And actually what the question is about is mental health assessment. What is your competency? So it's a very good question. And especially during this COVID period, there's a lot of encroachment on the profession of mental health and psychology. So you want to make sure that the person who is telling you they are competent has the necessary educational background. I am sorry, but if you have a diploma, no. If you have a certificate, no. To be able to get to that level where you can do assessments for people, we are talking about people in graduate school. I know a lot of people don't want to hear this, and they're saying that we are denying people with first degrees, diplomas, and certificates jobs. But you see, you can't compromise people's health for the sake of advancing people financially. Let us attack the problem that is there. And the problem is that there is a huge problem of investment and access. So let's talk about that. Let's talk about investment and access. So when we talk about a holistic program to address mental health in this country, you have to therefore understand, even by listening, we are not just talking about the health bit, which is the treatment bit, the sick model bit, which unfortunately is the one we are practicing. We have to be able to move to a preventive model We have to move to a model that builds on capacity building in the profession, not just at a community level. At a community level, it is critical that there are those people who can be able to provide that initial fast contact assistance. But there has to be a system of referral where a person can actually get the correct help that they need to sustain their mental wellness. Mental health, psychology, psychiatry has been treated like rocket science in this country, and it is not at all. We just have to be able to realize that mental health for all affects all, and it is for all. Then we just move from there, and we will be able to find it in schools, we'll be able to find it at work, we'll be able to find it in security agencies, we'll be able to find it in homes, because even right now, as we're talking about, World Mental Health Day and what was said by the people who run health in this country, I did not hear any mention about schools and pupils and students are going back, and teachers. I didn't hear anything about the support for that. So that is left like that is a Ministry of Education responsibility, but it is still under health. What do we do? So this mainstreaming of mental health care, really, we need to think about it critically. And we need to actually look at it from a very systemic and holistic perspective. All of us, we really need to do that. So I hope that answers your question. Yeah,
okay,
thank you.
Mukuria, thank you. I'll go to the two last questions before we give our closing statements. And there's a really good question here about why are mental health organizations mostly non-for-profit, NGO type? Just curious as to why. Is it because we cannot generate enough interest in counseling to be self-funding?
I think maybe I can also give our perspective because Inuka is a social enterprise. So primarily we work with companies and we provide their employees with well-being programs through self-testing, well-being scans and coaching. We find that, again, it can be quite challenging to show or to companies the value that investing in their employees' health has. However, we are making at least progress. So I think COVID-19 has actually highlighted the fact that when you have remote workers, it's even harder to monitor and support them, and you need tracking tools. And because Inuka is an online digital well-being platform, we're able to get aggregated and anonymous data on how people are doing. Are your staff primarily at risk? Are they resilient? Are they in a tough place? And at what point then, if they are in a tough place, then we do refer them to now medical service providers or company doctors or company therapists. If they are not, then maybe they just can be coached. So we're really trying to advance that. And we find that at least we are for profit in the sense that we work with those companies. However, it is very challenging. And I think a lot of companies that are trying to transition to for-profit in well-being just have a very steep road ahead of them.
Yeah, thank you. Thank you for that, Ankiza. And I can also just add to that a little bit. I think it's also a problem of culture, even among the corporates, in terms of taking care of the employees. We still don't see as a society mental health as a huge need. And so people are left to their own devices or to seek out their own support systems. So there is still not a community or an organizational approach for most companies towards this. So I think if that happens, maybe it will be an easier transition for a for-profit model. I'll go to the last two questions before we wind up. There's a question here, and I'd love you to be very brief, Joyce. How are differently abled people with disability, e.g. hearing impaired, supported in mental wellness? You already talked about that, but are there specific facilities that cater for this?
Thank you so much for the question. Eunice Magoi also asked about persons with disabilities and mental issues and what are specific applications to resolve their challenges, especially in medical institutions. Now, when we've spoken on this panel, we've clearly distinguished institutionalized services with community-based, interventions. And I must say that all and sundry are welcome. In medical institutions in Nairobi and across Kenya, especially the government ones, we are getting increasing awareness. I must say today is better than yesterday. And we should all maybe end today's webinar by saying we are getting better and better. Today we were talking about the way forward. Today is better than yesterday, but we are not yet there, all right? So we still need government, the county government, we petition probably Nairobi Metropolitan Services to ensure more accessible information and communication to people with disabilities for greater access. There's a big issue of affordability. And then we have still very, very basic infrastructural issues, just about ramps. And some people who use wheelchairs can just not access the doctor's office. If we're talking about medical facilities, as Eunice asked. So we need some targeted measures that provide that holistic approach, as I said earlier, infrastructure, attitude, accessibility, affordability, access in all its facets. So that when we say we are truly inclusive, we recognize that people with disabilities have these conditions as pervasive in all their life areas. It's not like today you use a wheelchair and you can access school, but you cannot go to your doctor's office because there are only stairs and there's no lift or ramp. So we need to create more inclusive spaces and plan care and support long-term. One of the things I'd like to really start seeing is even just partnerships between even the counties, Nairobi Metropolitan Services, and all the ones around, because we know that we're in that bigger metropolitan space, but our service provision is still a big barrier. So specific facilities as per the law are required to tackle. We still have a few more things to put in place. Even when we have workers who are disability trained, they might only, like for instance, you can find in a big hospital, there are only 2 nurses who are trained in sign language, and at any one point in time, they may not both be on duty. They may both be off duty. So somebody accessing the big hospital, I don't want to mention names here, will find a very big problem just accessing the services. So the training is ongoing, but it needs to be sustainable. It needs to be continuing education. And then we need to create disability mainstreaming trainings, not just for people with disabilities, but for everybody in our institutions and in our community. So I wouldn't really say that there's a specific facility for mental health, but I would say that increasingly as we continue, I'm optimistic that we will be having more inclusion that is more a reality than just mere rhetoric. Thank you.
Thank you, Joyce. Thank you for giving your answer and your closing statement. We have a question here from Hagin Watwati. I've seen your question about you needing support for your community. Forwarded it to our programs person who will get back to you about that. And so I think at this point, let me just read one more thing from Stella. She says that, and you can please, all of us, just go to the comment. There's Stella's comment about facilities in Nairobi that offer psychosocial support. Please go through that. It's a long one, so just go through that. So panelists, I'll invite you for the next 1 minute to project into the future and look at where you think the country is going generally as pertains mental health. And if we are going in the right direction or not, and what you would love to see happen. So we can start with you, Daphne.
Thank you, Bright. I think what I would like to say in terms of the future outlook, obviously, there is more and more awareness about mental health. And I think I want to echo what Major Mukuria said about prevention. We really have to focus on prevention. And one of the things that we need to focus on as a country is on adverse childhood experiences and adverse community experiences. talking about child abuse, neglect, domestic violence, alcoholism, and all of those things, that when children are exposed to those things, those things have a negative outcome in terms of their mental health and even physical health in the future, all the way into adulthood. So I think as a country, if we're thinking about preventive mental health steps, we need to think about child protection, in the homes, in the schools, in our communities, addressing community violence and other adverse community experiences. The other thing that I want to say is I would really like us to, I would like to see us take a public health approach to mental health. And by that, I mean, for example, during the pandemic, I'm sure the vast majority of Kenyans right now, regardless of which corner of Kenya they live in, they know of some steps to take to prevent the spread of COVID, hand washing, physical distancing, cover your cough, respiratory hygiene. I would really like to see us getting this information out so that people know the steps to take for good mental health. We can get some mindfulness tools out there to everybody using whichever means that we use to disseminate other health information, public health information. So that's really what I would like to see happen, is us making this information like really accessible to everyone, regardless of whether they have access to a phone or other technology, that people should know the steps to take to enhance their own mental wellness and resilience.
Thank you, Daphne. I'll go to you next, Lucy.
Okay, right. At a personal level, I did not feel assured or comforted when.
Jessica, please mute your. Can you be muted? Thank you.
It's a good beat. It's a good. Anyway, now coming back. Right. I honestly did not feel assured. The body language, the speech. Hey. Okay. If this carries on, we should just take this thing to the next level after this. I did not feel assured just from the body language and the speech patterns from, the people who are supposed to address mental health in this country. I felt there was a lot of hyperbole because there's this idea of continuously keeping mental health care as a future prospect. Quite oblivious that in the present, there is so much that can be done because it doesn't take structures. Daphne just talked about essentially mental health hygiene. That's what you need to teach people. Psychological first aid, that's what you need to teach people. This idea that for mental illness, you first wait for the person to get sick, then you treat. We need to get out of that completely. But I think most importantly, more than anything, all the non-governmental entities, social enterprises, NGOs, whatever, that are actually doing this work need to understand that to be able to really make progress, there has to be change, like from our laws, from even the attitudes. Because even when you talk about how could the police treat people, this man like this, Bright, and this is not, I'm not saying that you did anything wrong or whoever reported it. I'm just saying that the police do that because, in the security industry, we say that is what is in the pamphlet. Pamphlet. So the reason why, for example, we need to decriminalize suicide is so that they have a new pamphlet. But as long as the pamphlet that they have is still reading that somebody has committed a crime, it is their duty to go and arrest that person. And though it is morally wrong, legally, they have the mandate, they have the right, they're actually executing their role. So I think to be able to just understand that we have to do things all at the same time. We can't just say, now we are going to build hospitals. No, we have to do everything at the same time, because what is happening is also happening to everyone, everywhere. And therefore the investment has to be greater. The access has to be improved, but we have to raise our voices. Thank you so much.
Thank you so much. I'll go next to Stella. Are you still there? Do you want to give a closing statement? I think Stella is having internet issues, so we'll close with
Yes,
Ankiza.
I am. I mean, can you
Okay.
hear me?
Okay, yeah, go on.
Yeah, so for me, it's just to say sometimes it's heartbreaking to see, because when you have a passion personally for mental health and you see things are not moving, it gets very discouraging. And I can really resonate with all of you, the panelists, and the people who are also struggling with mental health. But I've come to have this thing that it's the little things that we do. You can imagine where I stand, where even now I'm talking to one of the directors and telling them they have advertised job for 3 years. We don't have a single counselor, psychologist. Nairobi as a county, we only have one psychiatrist. um, you can imagine the challenge that is there. But I told myself I'm not going to give up. It's the little gains that I'm going to leave as I'm the coordinator, the steps that we'll do that keeps me going every day. When we carry the whole burden of 5 years to come, we will not be able to do what we need to do today. So let's fight and let's not give up because of the, the allocations, because of the bills. It's very discouraging. But I think for me is let's do the little things that we can change, be the change agents, and lastly come together. For example, for us to be able to have the board commissioned, we need to come together. Why is that board not being commissioned? Because with the board is when we are going to be recognized as professional. I mean, I come from a health background and I can tell you where we have challenges, even having psychologists being employed, because we are not yet recognized as what we call health professional. For you to be recognized as a health professional, you must be registered and regulated by a board. Until we get that board, we are still going to be like any other. They can employ, like now we are having people being employed with double major and they are being called clinical psychologists. So it calls for us to come together, put our efforts together. And if I would say one of the things we need to do urgently is to have that board. Without that board, we are still going to make noise. We are still going to feel angry. Like you went to school, spent money, and now I have people who reported and they have a double major and they have been employed by as clinical psychologists. I feel for the clinical psychologists who have spent 5 years doing their masters. Now I can proudly say in Nairobi, I have 10 of them. You see, it's laughable, but let's come together and use all the resources, be it getting a lawyer, be doing what, to have this board in place. It's going to kill some of this madness we are seeing among our profession. Lastly, let's stop fighting. Let's stop fighting among ourselves, because we are so good when we come on media, but we need to put I'm a health psychologist. I'm not any better than a clinical psychologist. We have trauma counselors, we have child therapists at master's level, and that is what the doctors beat us in. Once you specialize, whether be it a surgeon who does the most and it's the most hard one, be it a pediatrician or a gyna, all of them are consultant. This thing of fighting clinical psychologists are superior, it's what is killing us. Let us all go to our specialties and all of us become specialists. I am very proud as a health psychologist. We are only few, and I'm proud I was the first to graduate from the Kenyan market, but I'm not any superior. That is what is killing us. Let's come together. Let's fight for our recognition as psychologists. At master's level, let's recognize all the relevant specialties, and we are going to go far. Thank you so much.
Thank you. Ankiza, please give your closing statements.
Yeah, thank you, everyone. Number one, I want to add greater investment. Very little is spent on community services, and we need to make sure we also pressure government to invest more to ensure people can live in dignity. There is a need to spend more money there because we know socioeconomic issues play a huge role in the mental health pandemic we are seeing. If I do not have a job, if I do not have employment opportunities, I am in a worse mental and emotional state because I cannot feed my family. So we need to also remove that stigma of you have a mental health issue because of some hereditary, this is as serious as I cannot feed my family. Number two is the role of technology in solving our healthcare issues. We can't deny that we have a 91% mobile penetration in Kenya, and about 43 million people have access to a mobile phone. Now, Inuka seeks to lower the barriers to access mental health by using technology. And we don't just have to have an app or WhatsApp. We can have SMS-based solutions. So it's very important for us that we continue to champion and say we have a very youthful population. People are on their phones, meet them where they are at. So it's very important we do that. And lastly, I agree with Stella that we need to come together and collaborate and not have a competitive spirit. So we know already that there are not enough psychologists or psychiatrists for the population's needs. So, and we are not able to graduate enough people for that. So what about alternative methods? And that's where we're coming and saying, great, we have coaches who are also able to deal with these preventative measures or mild and moderate measures. And of course, we work hand in hand to refer acute cases to the centers that help them. So I really hope that we all walk away today with a lot of inspiration and knowing that there is hope, that we need to amplify our voices and let people know that different types of coaching or therapy or counseling is available to them, and on their mobile phone if need be. But thank you all.
Thank you so much. In closing, I'd like to invite all of us who are attending this session today to follow the various organizations on social media. For us at Mentor 360, it's a huge way or one of the ways we interact with our community. So follow us on Facebook, Mentor 360, on Instagram at Mentor 360 Kenya, and on Twitter at 360 Mentor. We also have a new interactive platform on Facebook. It's a group called BOMA by Mentor 360. We are working on a few projects to also, as Ankiza mentioned, moving more into the digital space and meeting people where they are. Please follow us there and we'll engage more. Thank you so much for showing up today. It's been an excellent session and I'm really proud of all of us, and I'm really happy and feeling positive for the future of mental health in Kenya. Thank you and goodbye.
Bye, everyone.
Bye.
Bye, everyone, and thank you.
Goodbye. Thank you.
Bye.
Bye, people. Thank you so much.